Hello, this is Amaka, and today I'll be reviewing the article How Many People Die from Flu, published by Our World in Data. To talk through this article, I'll be going through the following outline. Influenza, commonly known as flu, is a highly contagious respiratory illness that affects millions of people worldwide each year. Despite being a well understood disease, flu continues to pose significant health risks, especially among vulnerable populations. The objective of this review is to see how many people die from seasonal flu, how those numbers have changed over the years, and factors that increase the risk of dying from flu. In a few seconds, let's take a sneak peek into the original article. The piece was created by Saloni, Dattani, and Fiona from Our World in Data. Influenza-related mortality datasets collected for over 30 countries from multiple sources, primarily the World Health Organization, United Nations Population Division, and the Global Influenza Mortality Research Project GLAMOR were used. It is not particularly clear what data processing methods were deployed, but some statistical analysis using multivariate linear regression modeling was done. Grapher, an in-house open-source tool proprietary to Our World in Data, was used to explore and visualize the datasets. To summarize the article, it is quite difficult to answer the question of how many people die from flu because the symptoms are similar to other infections, and in most countries, only a fraction of patients actually get tested to confirm the disease. Secondly, influenza can lead to death in many other indirect ways, such as pneumonia and heart attacks, so there are high chances of underestimating these numbers. Looking at the visuals from the analysis, there are clear variations in the proportion of flu-related deaths per 100,000 people in the population, the chart to the right. On a global scale, Africa, South America, and South Asia experience more deaths from flu. For instance, Argentina had more than 3 times the death rate in Canada. This could be attributed to lower access to healthcare. In Russia, rate of deaths from flu was 27.7 per 100,000 each year among those who were 65 years and above, which is 3 times the risks from traffic accidents that kills 9 per 100,000 in the same age group. Death rates from influenza are much lower now than in the past due to changes in size and structure of the population. What this means is that the likelihood of someone dying at a given age from influenza has declined over time. Age continues to be a major risk factor for dying from flu. This increases exponentially with age. For instance, infants and the elderly tend to have heightened risks. Other factors are accessibility to quality health care, vaccination status, and the strain of virus the individual is infected with. Looking at the global death toll from influenza pandemics, we discovered that some flu seasons are more severe than others. For example, the Spanish flu killed an estimated 77.4 million people between 1918 and 1920. Generally, the creators of this piece did a great job. Some of the strengths of this analysis are a detailed historical context. The analyst provided enough background information, making it easy to follow through. Secondly, these visualizations are very interactive, which allows users to explore the data trends over time, thereby enhancing user engagement and understanding. And lastly, the charts are clear with well-written explanatory text. Looking at the weaknesses, a key weakness is the data limitation and uncertainties, and there's also lack of real-time data. Use of historical data may not reflect real-time changes, which is important for rapidly evolving health crises. In terms of suggestions for improvement, this piece would benefit greatly from enhanced discussions on the process. So a more detailed discussion on the data format, the wrangling, and the methodologies used to estimate the flu mortality and the potential biases would strengthen the analysis. Also, inclusion of more recent data sets. While the article is quite comprehensive, it primarily uses data prior to 2019, and considering the impacts of COVID-19 pandemic on healthcare, one would think that including that information would make this analysis more current and relevant in predicting future outbreaks. In conclusion, while we cannot categorically state the number of people who die from flu due to obvious reasons discussed earlier, there's been a huge decline in the burden of flu over the years, and with greater efforts and public enlightenment campaigns, the numbers would continue to decline even further. Thank you for listening.